Hey everyone. My last video got such fantastic responses. Thank you for that. And I did ask people to send me suggestions for what you'd like me to record next. And the number one choice so far, and I put them in order of popularity, is depersonalization and derealization, or DP and DR, as they're often called by psychology and psychotherapy. Um, so many people want to understand what they are. Why? Look, I suffered from them too. I had them for on and off for the 22 years that I suffered, but probably in bulk, mostly at the end for about 4 years. Um, I think derealization was the most problematic because it was the most constant. That was pretty much 24/7. And so dealing with that was difficult because when something is a constant, when it's always with you, regardless of where you are and what you're doing, it becomes very noticeable and it becomes very influential. And the problem is you start then making decisions about what you do with your life based on these experiences. And that's true of all of the manifestations of fear disorder. Notice I said fear disorder here and not anxiety disorder, because anxiety is disorder. Fear is the natural, normal human response to perceived threat, and anxiety is the disorder of that fear. So you can't have an anxiety disorder because anxiety is disordered. You don't call anxiety disorder, which is in essence what would be doing. So fear disorder produces and manifests a massive array of physiological experiences. I'm not going to call them symptoms because you can only have symptoms when you're ill. This is not an illness. In the same way as being overweight or unfit isn't an illness, it is a physical state. So perpetual fear is a physical state because fear is a normal and necessary human response. So when it's disordered, it doesn't make it any more. It doesn't make it an illness. It makes it just more of the same, and that can be incredibly uncomfortable. It can be frightening. It can be massively influential in many ways, physically influential, but also psychologically influential because you make decisions based on what you're feeling. And what you're feeling is the best measure for anything. I think it was Maya Angelou that said, people don't remember you for what you said or did. They remember you for the way that they make people feel. And it's absolutely true. Feelings are so influential. So when you feel frightened, it's influential. When you feel pain, it's influential. When you feel discomfort or your heart racing or you feel short of breath, it's incredibly influential in your life. It forces you to make decisions that you wouldn't otherwise make. In the same way as you'd make a decision, for example, about, if you were drunk, you'd make decisions that you wouldn't normally make. Hopefully good decisions despite your drunken state, but yeah, still different decisions because you're not in right mind. And because derealization and depersonalization, unlike other physiological experiences that you have in anxiety, like a racing heart or shortness of breath or tingling in your extremities, DP and DR feel influential because they feel psychological, because they feel like there's something wrong with your brain, that you're not reading the world as you should be, and that's not actually true. They make you feel that way, but that isn't systemically true. And I'll try to explain. When you go into fear response, so that's normal, what people would call fight or flight. I call it the fear response mechanism because it is a mechanism. You've identified threat, you've risk assessed it, you've gone into fear response. It's a mechanism. Just like how the brakes work in your car or how the air conditioning works. It's a system that has one function and works in one particular way. And fear is exactly the same, albeit not mechanical, but biomechanical in effect and chemical. So when you go into fear response, a whole load of intersystemic changes happen. And they happen across all of those systems, your respiration, your circulation, your endocrine system, all of the systems work together to either support the fear response or to in some way empower the fear response and activate the fear response. Depersonalization and derealization are actually vital parts of that fear response mechanism. They are not illness. They serve a purpose. Now, look, I sat in front of many psychologists and psychiatrists, counselors, and all kinds of medics when I had anxiety. And I kept asking them, why do I feel so dreamy? Why do I feel so detached? Why do I feel like I'm not living my life? And I've had many tens of thousands of sufferers tell me that they've done exactly the same. They've gone to medics and psychologists and psychiatrists and said, what's this all about? Psychiatry veers towards, well, it's, you're detached from reality. You've got it's a disorder arising from chemical imbalances in your brain. It's associated with true clinical depression, with disassociation. No, it's not. I've even had people be told that they have psychiatric issues, they have psychosis, and therefore are suffering from delusions or disassociation. That's not what this is. It just isn't. And the thing is, anybody that understands the psychophysiology and neurology of these conditions fully, and I believe I do. Look, I'm not a neurologist, I'm not a doctor, I'm not a psychophysiologist. I'm certainly not trained as a doctor or psychiatrist, and to an extent, thank heavens for that, because they're indoctrinated into belief systems. I had psychiatrists come to my retreats that said, why wasn't I told this? Oh, wait a minute, I was at medical school, I was told all of this. But then I went to be a psychiatrist. I was told to forget all of that in favor of the practice model, in favor of giving out medication as if it's sweets. So it's not that this isn't known science, it's just known science that isn't utilized either because doing so would veer people away from the accepted profitable methods that are used to treat people with these conditions, or through ignorance. It can be nothing else. But without exception, every doctor, psychologist, psychiatrist that has been through our retreats and workshops, every single one I've helped myself personally, they kind of look at me and go, but I knew this. The problem is DP and DR aren't something that we would identify in normal fear. So in other words, what I'm saying is when you get into a fear response, whether it's, a close car crash or somebody chasing you or some other threat, you don't analyze what it is your body is doing. You just feel the fear. So you're in the situation, you detect the fear catalyst, and you go into fear response. And from that point on, it's just a mess of experiences until the whole thing settles down and the fear and the threat is gone. You don't sit there and go, right, what are these stages? What's happening in my body? Let me understand the psychophysiology. Let me understand the neurology, the endocrinology of what's going on. You just accept it as normal, in the same way as you accept getting fit as building muscle mass and increasing cardiovascular health. It's a superficial reflection of what you achieved. You don't, when you lose weight, you know that you're eating less and moving more, and that the result is that there's fat being taken away from your body, but you don't actually analyze how that's happening, what's happening. Some people might, and they might want to understand the whole dynamic of that in the human body, but most people just don't give it any thought. And this is what psychology and psychiatry rely on, the fact that we don't understand, and so they can pretty much tell you what they like, and you have to accept it. I mean, I had psychiatrists told me to, for example, one told me that I needed to, and excuse me for telling you this, masturbate myself well. Another one told me I needed to go into the countryside and get a tent and live in the countryside amongst trees. Another one told me that I needed to go home and have it out with my dad. Why? Dad had done nothing wrong. I've had people use psychedelic drugs in psychiatric practice, and have that experience with people. They'll make up and talk about anything, but they won't tell you the truth. So when you have an anxiety condition, it's important for every sufferer to know the truth, and the truth is this, and I'll spell it out very clearly. If you have a fear disorder, in other words, if you have generalized anxiety or health anxiety or panic attacks or agoraphobia or monophobia, if you have an eating disorder, if you have, did I say emetophobia? If you have, bulimia or anorexia, you haven't got a mental illness. It is that simple. And I promise you, if we spent time together, sat in a room together, and I went through and explained exactly what I mean by that, within 10 or 15 minutes, you'd be sat there saying, yeah, I agree, Charles, it definitely isn't. The thing is this, if anxiety issues, fear disorders, are mental illnesses or chemical imbalances in the brain that can be corrected through, those medications that have been synthesized to correct those things, like SSRIs or sedatives, or um, they don't act on the anxiety. They suppress the experiences that anxiety would give you. So if anxiety conditions are mental illnesses, then so is diabetes, for example. So is menopause, for example. And you and I both know that that ain't the case. You know that menopause isn't a mental illness. You know that being overweight isn't a mental illness. You know that diabetes isn't a mental illness. So therefore, given the science, neither is anxiety. You can't correct anxiety with medication or with breathing exercises or relaxation or meditation or eye movements or talking about it or rating it or focusing on it or exposure therapy. It's lunacy to believe that you can, is the truth. So bringing you back to DP and DR, depersonalization and derealization, within the fear mechanism, within that mechanism that your senses identify the threat. So your eyes, ears, nose, mouth, and skin identify a threat. Your brain then does a risk assessment, a what if, and then, given the outcome of that risk assessment, is it a positive or negative? Should I be afraid or should I not? If it goes down the route of should I be afraid, yes, it activates the amygdala. The amygdala then activates the fear response mechanism. Within that entire mechanism, there are a number of things that go on. And one of those things is what's called hypervigilance. It's when your senses become incredibly sensitized. So that's why you get dilated pupils. That's why you might hear ringing in your ears. That's why you might get prickling on your skin or increased blood flow to your skin. All of these things are part of hypervigilance, a way of sensitizing your sensory organs. Within that same process, there's a process that goes on that produces what people call derealization and depersonalization. Now, these names are so counterproductive, they are not at all indicative of what's happening in those two instances. With depersonalization, you're basically getting that sense that you're not yourself, that you're detached from self. That serves a purpose when you're in fear response, because what it does is make you selfless. When you're on an aeroplane and they say, in the event of a drop in cabin pressure, the oxygen masks will drop down. It's important that you always put yours on first before you help somebody else. Do you remember that? If you've been on a plane, I'm sure you do. The reason for that is because if you don't put that on, and there is a drop in oxygen levels and you become unconscious, you can't help the people next to you. You can't help the children or your husband or wife or whatever. So the thing is, you save yourself first and then you take action. This is exactly the same as that. Depersonalization is a way of saying, getting rid of selfishness to become selfless. So what you do is, in your fear response mechanism, you lose your sense of self because you're preserved anyway, you're fine, so that you can then selflessly help other people. So if there's a burning car, for example, you won't run towards it if you think, oh, well, I could explode, I could burst into flames. So you lose the sense of self so that you can take action within the fear response. Does that make sense? With derealization, that happens, and it's all neurological. It's created neurologically in the fear response mechanism. That happens so that you have this tunnel vision type focus on the actual threat. So it blurs out everything else in effect. Yeah. So, and that's what derealization feels like. But you see, when you're in fear response and it's appropriate fear response and you're dealing with an actual threat, that's absolutely fine, because it happens for a minute, 2 minutes, 3 minutes, 4 minutes whilst you're dealing with this particular situation, this threat situation. And then it goes away. So your fear levels drop and all of the associated manifestations that are created by the fear response slope away. So you go into fear and it all comes up, you go out of fear and it goes down. That's how it's meant to happen. But with a fear disorder, it's gone up and it stayed up. So all of those manifestations are constant. The racing heart, the breathing, whether it's hyperventilation or hypoventilation, the changes in your digestive tract, the slowing down of the digestive process, the movement of fluids from the digestive tract into the blood so that you can transit glucose and oxygen more effectively. All of this is happening autonomically without your conscious control, and it's happening constantly in fear response. And in anxiety, it's constant in anxiety. That's why people get things like IBS and bloating and distension and acid indigestion. This is why people feel dizzy, why their eyes are blurred. This is why people feel tingly in their limbs or experience tightness in their back or chest, or and obviously their racing heart, the palpitations, the missed beats. All of this is normal, but it's only normal in fear. In anxiety, anxiety is abnormal because it's disordered fear, but it doesn't make it any more threatening. And this is what people have to understand. So depersonalization and derealization, they're influential. I had them, horrible. I wouldn't wish them on my worst enemy, but they're inconsequential, despite being disturbing. If you don't understand them, they're even more disturbing. But this is the point. You won't find a psychiatrist or psychologist on the planet that has learned what I've just said to you in their practice training, because they're not told this, because basically they don't know it. Psychology is a practice. It isn't even a practice. It's a theoretical field of study. It should never leave a university or a college. Psychology is taught so that you think about, why does the body do this? Why does the brain do this? Why do we react this way? It can't become clinical, because the only thing that can become clinical is from a medical perspective, from a medical background. And a medical background means you need to be a medic first, and then learn the psychology. Well, if you know the medical background of what I'm talking about and you do psychology, as soon as you get into psychology, you realize that psychology is nonsense and that it's not teaching you the true physiology. And this is why the whole system breaks down. This is why people don't recover, because there's no communication. And when you're doing a medical degree and you decide to specialize in psychiatry, you don't carry any of that science into the psychiatric practice. All that you learn to do is say, oh, you're having panic attacks. Well, that means you need a sedative. Here's the prescription. So they're just pill pushers, basically. And I said in the last video, there's a fantastic, I'll try and post it, but there was a fantastic documentary done where they went and spoke to psychiatrists and asked many, many, many psychiatrists, in your entire experience, in your career, how many people have you cured? And it's shocking. The response is mind-blowing. They laugh. Nobody. No, nobody. It's disgraceful. It is appalling that a practice model exists to treat these conditions, and yet they laugh about not being able to cure people. And yet people come to me and us as an organization and do our psychoeducational programs, and they recover. It's not acceptable, is it? Recovery should be available to everybody. Science and the science of what they're experiencing should be available to everybody. But instead, people choose to go and see a psychologist or a counselor and do CBT, DBT, NLP, EFT, EMDR. All these acronyms are a way of saying, give me your money, but I'm not going to cure you. The truth about anxiety, DP, DR, panic disorders, OCD, Puro, is in the science of those conditions, not in the justification of a business model. It's appalling. I was prey to it. It cost me a fortune, and I lost my home because of it, because I had to pay bills to people who their best advice was buy some girly mags and go home and be happy. And I genuinely mean that. If you want to recover from your DP and DR, you need to understand the science of how and I've just explained some of that. You need to understand the science of how those and other manifestations of anxiety and fear disorder can occur in a human body. Once you know that, you're secure in the knowledge that there's nothing wrong. Then you have to understand how to use that same science to elicit recovery. In the same way as you have to understand the body in order to build your biceps, build your triceps, get a six-pack, and build your leg muscles. If you don't understand the science in that these exercises act on these muscles, and these muscles need this amount of fluid and this amount of sustenance in order to build, and protein in order to build the muscles, in order to increase the size of them, for me to create the desired effect. People are very, very knowledgeable about what they should and shouldn't be eating when they go to the gym, but they're not knowledgeable about the things that can cause these anxiety conditions. And bear in mind, anxiety conditions represent about upwards of 90% of all categorized mental health conditions. And everybody is told, oh, you have to learn to cope and manage. No, you don't. No, you don't. That's for the benefit of the practitioners and their bank accounts. That's not for the benefit of the sufferers. If the sufferers were told the truth, they just recover like our clients recover. And we've had testing done by the NHS and by independent bodies and universities, and the second that stuff gets out there, people say, "Oh no, hold on, no, we can't cure people. That would break the business model." The truth needs to be available to every sufferer, and especially since lockdown, since the whole COVID, COVID event, let's call it that to be safe, right? So I don't upset anybody. Since the COVID event, those waiting to develop their anxiety condition because they can have been activated. Kids of 2 and 3 self-harming. What? No. And they're now in a treatment bottleneck, and the bottleneck is leading into a treatment plan that won't help them. It's mind-blowingly frustrating, but more than that, it's crazy sad that people have to suffer from this when it's so preventable and needless. So if you've got any more suggestions for videos that you want, if there's things that you would like me to do, go to anxietyproject.online. You can either sign up or contact us through that. Let me know what you'd like to hear, and I'll do some more videos. I want you to understand, because knowledge is power and knowledge is recovery. Take care, guys. Lots of love. Thanks for listening.